Good afternoon. Today, one of the biggest discussions in today's news and today's society has to deal with these school lunch programs. Today, I would like to talk about the school lunch programs because they're affecting everyone who have children in schools, and believe it or not, it affected the education that we all received. So, my goal for today is to give you a brief history of where these school lunch programs began, to cover how the program is causing more childhood obesity today, and to cover how the economy affects the program. So first I'm going to start out by giving a brief history on the program so that everybody is kind of on the same page in understanding where the program began. And according to the Education Bug, which is a site with some of the most recent educational resources, the school lunch program in the United States was designed for feeding the young men that were rejected from the draft during the World War II era in 1946, and it was created by President Harry S. Truman. Now, it was instated due to a medical condition that is now today called childhood malnutrition, which is children being underfed. And it did not only address that the young men were being unfed or underfed, but it also began dealing with the fact that all children in the United States were suffering from malnutrition or being underfed. The program reaches the public and the nonprofit private schools, and in this area that affects all school systems because most of the school systems in the area are public schools, but there are a few private schools. And in 1946 was where the program began, and at that time it only offered lunch to students. But in 1966, President Lyndon B. Johnson extended the program by beginning to offer breakfast to the school children. And the Education Bug says that, quote, there were also concerns that the poorer families could not always afford to feed their children breakfast. Johnson believed, like many of us today, that children would be better in school if they had good breakfast to start their day. The pilot was such a success that it was decided the program should continue. So by 1975, breakfast was being offered to all of the children in public or non-private schools. The change was made because educators felt that more children were skipping breakfast due to both parents being in the workforce and long bus rides to school, end quote. So basically what they're saying is that all children, whether they could afford the breakfast or not, was being offered breakfast at school because the educators felt that children weren't eating because either their mother and their father or the parents they had at home were leaving before they had a chance to fix the children breakfast, and they did not get to eat breakfast because they were on long bus rides to school. In 1968, a summer meals program was offered to low-income children, and this included breakfast, lunch, and afternoon snacks, which were available to students each year during the summer break. And in 2004 and 2005, over 9.2 million children participated in the breakfast and lunch program. The program was created for lower-income families, but it is now offered to all school children. So basically this program was intended for the poor families in the United States. So now I've given you a history of the school lunch program so that we can all better understand what we're talking about. So now I'm going to begin talking on how the obesity rate in children has begun to rise since the school lunch program has begun. The Center for Disease Control and Prevention states The dietary and physical activities, behaviors of children and adolescents are influenced by many sectors of society. This is including families, communities, schools, child care settings, medical care providers, faith-based institutions, government agencies, the media, and the food and beverage industries and entertainment industries. To me, this is saying that the behaviors that children learn through school and family affect how they choose to eat and exercise. And I feel that a big part of it is due to the food and the beverage industries. If you watch the commercials that are on TV, then you will see that kids are very, very influenced by what they see on the television. Because you see on McDonald's commercials, Ronald McDonald giving children chicken McNuggets and hamburgers and French fries. And the children think, oh, well, I can just be like these children and eat whatever I want to, whenever I want to. So they're more likely to ask their mother and father or their parent figure to stop at McDonald's and get food instead of the parents doing like a home-cooked meal where they can control the amount of fat that the children are given. In the article from CBS 19 News, and it's entitled Scary Statistics About School Lunch, Elizabeth Jackson said 1/3 of the kids in the United States are now overweight or obese, which means 1/3 of kids are at risk for heart disease and diabetes as they age. And she said that scares her because if we don't do something now, the recent trend toward fewer deaths due to heart disease among U.S. adults is in jeopardy of reversing. So what she's saying is that due to the obesity rates, more adults are dying of heart disease. And this goes back to what the children are eating. Parents try to regulate, mainly what their children eat. And we know it's hard because you can tell a child, you can't have the chocolate cake until you finish your dinner. But the child doesn't care. They just want the chocolate cake. That's all they're interested in. And after looking at school lunch menus from Hawkins County school systems and Sullivan County school systems, there are very noticeable differences in the food choices that are offered. According to a Hawkins County Schools article titled Childhood Obesity in Tennessee, Tennessee has the 5th highest rate of adult obesity and the 4th highest rate of overweight youths, which are from ages 10 to 17 in the nation, according to the report by Trust for America's Health. So the statistics that they gave in this article were obtained through a health-based study. And what it shows is that, Tennessee is the 5th for adult obesity and 4th for childhood obesity. And so what this brings to my attention is that the foods that schools are feeding the children are really kind of having a increased effect on the rate that if the child is obese in between ages 10 to 17, there's a more likely ability that the child is going to be obese when they hit adulthood. In my opinion, some of the lunches that are offered on an everyday school basis, they are not healthy. They're not really regulated. Some of the school lunch menus, like take for example the Hawkins County menu for October, the meals consist mainly of things that would be considered deep fried foods such as chicken nuggets or corn dogs. They consist of pizza and French fries and tater tots. And all of these things, when you think about French fries and tater tots, you think of deep fried foods. And deep fried foods aren't healthy for children. It's not healthy for adults. It's really not healthy for anybody. And it really affects the learning process that children have, because after lunch they just want to sleep. In Sullivan County schools, it looked to me like they offered pizza along with, chicken, whether it be fried or grilled, and some sort of tacos that high school students may choose from. Now, the difference between these two menus is one is a list, the Hawkins County list, all schools are offered. But the Sullivan County list, this was only the high school menu, which really is a big factor in how obesity kind of gets away from us, and we don't really notice it because some school systems have more money to where they can offer the students more food like pizza and chicken and tacos, while poorer or lower income school systems can only afford to offer like corn dog and tater tots and chicken sandwich and french fries on any given day. Now that I've discussed the obesity issue, I'm going to briefly discuss how the economy affects the lunch program. And according to Joanne Guthrie, in an article entitled School Lunch, or National School Lunch Program, she says that in 2010, school cafeterias served more than 5 billion lunches, and more than half of those were free or reduced lunches. Free and reduced lunches are basically offered to those children of low-income families or middle-class, borderline low-income families. And according to Guthrie, an economic research service sponsored research found that children from food insecure and marginally secure households are more likely to eat school meals and receive more of their food and nutrients from the intake of school meals than other children do. So what she's pretty much saying is that lower income students are relying more on the school lunch program for their nutrition, and they can't afford to go get this type of food at home. So what the school lunch program needs to do is monitor the nutrition of the food so that they can teach the children to eat healthier, so that the children can have a meal and they're not hungry as quickly as they are. Many children complain that school lunches don't last with them through the rest of the day. Since the Hunger Free Kids Act was established, most children say that they are hungry by 2 p.m. during the school day. And in most cases, I know in Hawkins County schools that the school time goes from 8 a.m. until 3 p.m. And lunchtime in those counties are from 11:30 until 1:30. And in Sullivan County schools, they start school somewhere between 7 and 7:45, and they get out of school at 2:45. So at any obvious certainty, the children who become hungry by 2 p.m. during a school day either have 45 minutes or an hour longer that they are at school before they can go home and get food. And most times, children have at least a 15 to 20 minute bus ride, and some at the most have an hour-long bus ride. So it is showing that the school nutrition and the school meals are not meeting the children's hunger rates, because the children are becoming hungrier because the food is not as nutritional and healthy as it could be. And I hope that today I've given you more information on how the school lunch program affects the students, where it came from, and how the economy affects it. The history of the school lunch program shows us that it was it was designed to help those who could not afford to eat healthy and for those who are dealing with childhood malnutrition. But now we're beginning to deal with childhood obesity because the program is starting to get a little out of hand because they're offering deep fried foods and unhealthy foods to children for 2 meals during their school day, because that's where children mainly rely on their breakfast and lunch is their school. So what we need to do is take a look at these school lunch programs, the meals that are being fed, and we need to try to provide healthier lunches and healthier breakfasts that are going to last the children longer through the day. Thank you.